Welcome in, everybody. We will get started. Excuse me. My name is Danny Rubin. I'm the founder of our company, Rubin, and we provide online resources for business communication skills. Teachers, a show of hands, please. How many students will write you an email, but it looks like a text message? Any hands for that? Or how many students might struggle to speak on the phone and have confidence on the phone as opposed to texting? So we help students with a variety of communication skills through curriculum and webinars. And we have a special guest today, a certified surgical assistant, Alex Leming from Virginia. And we're happy to have her in her busy schedule. We appreciate it. And we will start to talk with her in just a few minutes. We also have Andrea here providing sign language interpreter services. Thank you very much for that. And I do want to come back to Nick's. Nick is a teacher exposing kids to as many jobs as we can. The kids love it. I'm so glad you're with us in Butte County and everybody from around the country. Thank you for joining us. Before we dive into our conversation today, I do first want to share a few announcements. And one is something that we mentioned on our last webinar. How many of you from our email list have you seen that we're hosting a national contest that starts next week called America's Next Great Intern? And I'll put the link to the contest in the chat for you. We would love it for you and your students to participate. We're challenging students to show us their employability skills, their communication skills, to a free contest with national recognition and prizes. And all the information is on our contest page at the link I just gave you in the chat. So please visit and look for the link to register. Teachers, register your class, register your students, open to middle school, high school, and post-secondary. And everything starts a week from tomorrow. So please join us. We'd love to have you. We already have schools from around the country registered to participate. This is new for us. The submission period is the month of February. So we hope that you'll join us. And we'll bring it up again towards the end. We also would love to give out free resources to everybody here. And this may be a resource you haven't seen from us yet if you've been here before. We have a Google Drive folder of free exercises for how to handle failure, how to respond when you don't land the job, how to reply when someone doesn't answer you the first time, how to improve your public speaking and your presence in a room. Lots of free activities, free resources. And if you would like these resources, this is all you have to do for those who have not been here before. Go to the chat right now and type, this is for the teachers to give to the students, not for students to request, for teachers to request. Go to the chat, type the word interested and your email address. Interested and your email address. And we will pass it along to you. If you're new to our community, we like to hold a very short phone call the day after the webinar to get to know your program and help you integrate these resources into your classroom or into your CTE program. So you can, if you're new to us, you can expect an invitation on your calendar for 5 minutes on Wednesday, the 25th. And if the time does not work, just reply back with a different time. It's very casual. It's just a way to say hello and make sure you know how to get to these resources and use them in class. That's for the folks who are brand new to our webinar. So continue to put your names in the chat. I'm going to keep moving. Okay. And if you are watching this on a recording, you can also have these failure resources. Email us to the email address in red. We'll send it to you. A couple other little news and notes, and we'll start our conversation. We have another webinar coming to you on February 15th. We'll be talking to a child care professional about their work. So please look out for the links to join that session in a few weeks. And finally, everyone, oops, sorry, wrong certificate, but everyone, well, I'll show you anyway. I put the one for next time, all the same. Every person here today will receive a certificate for today's session on being with a surgical assistant. You'll receive a certificate in your email on Wednesday morning. So look out for your certificate tomorrow. Okay. And we'll send out a recording of today's session as well later on tomorrow morning as well. So look for everything on Wednesday. But those are some news and notes. And again, I'll talk a little bit more about this contest towards the end today so you can really understand it. We'd love for you to participate. So with that, I want to bring our guest in, Alex Leming, certified surgical assistant at Sentara Heart Hospital here in Norfolk, Virginia. Thank you for fitting us in, and welcome to our Dream Job webinar. Let's start. Give us your job today, like what you do, and also take us back a little bit in your training, your path to get to what you're doing now.
Okay, hi everybody. Thanks for having me today.
Of course.
So I am currently a certified surgical assistant at Sentara Heart Hospital. You already said that. But in my day-to-day work life, I, in a nutshell, stand across from the surgeon as they are completing the surgical procedure, and I assist them in the procedures. So I am all hearts and lungs right now. That's what we do at our hospital. So I don't do a lot of general surgery. I do have some training in that from when I obtained my master's degree. So in the past, I actually was not really in the medical field. My undergraduate degree is in kinesiology, so it is a health science.
And what is kinesiology for those who may not know, briefly?
Yeah, basically the study of the movement of the human body.
Okay, thank you.
Yeah.
Okay, keep going.
So I actually worked for the Navy for a while as a fitness specialist and met my husband. We moved to Virginia, and I heard about this amazing program through Eastern Virginia Medical School for surgical assisting. I applied. I had all the necessary undergrad requirements, got in, and I have loved it ever since. So I have a year of clinical experience as part of my master's degree, where I did all sorts of surgeries. And then I landed my job at Sentara Heart Hospital, and I absolutely love it. Love the job.
What do you love about it?
So it's a very demanding job, long days, but it has just this adrenaline rush that I love from emergent procedures that we do. And we really make a difference in people's lives. People come in, and it's just amazing to see the change from, going from needing a heart transplant to having that transplant done and seeing them recover and be able to go home. So that's what I love about it.
Thank you. So a couple of things. First of all, as I am we're talking, I'd like for the teachers and students to now go to the Q&A area of Zoom, start putting your own questions. And when you put your question, include your name and your school so we can give you proper credit. So start putting your questions in the Q&A along the bottom. I want to explain, Alex, a lot of what we do, we talk about different careers, and we also talk about good communication skills. And what I did, you said you really love your job. So I said, well, what do you love about your job? To learn more, you were showing that you wanted to talk about why you loved it. So I asked you why. And just as we get going and people start putting questions, how important is it in your job to be very clear with what you're asking for and to follow up with someone to make sure you understand them before you make any kind of move? How important is that?
So I kind of chuckled when you asked that question because it is very important to have good communication skills in the operating room. If you are asking for a specific instrument or supply, you have to be very clear about what you need so that the patient has the best outcome. So close loop communication and double checking with people and making sure that they heard what you needed or heard you correctly or understood what you were asking for is very important.
Yeah, I would say so. And again, please start putting your questions. We have Nick, is it Strife? See if I get your last name right, from the Butte County Juvenile Hall. So what prerequisites did you have when you applied for the job you have now? Great question.
Okay, so for my job, I actually did an externship with the hospital that I currently work for, which was great because during school I got some experience firsthand of what exactly the position would entail, as well as the other staff. Because you want to make sure when you're going to work somewhere, apply for a position or apply for a program at school, that you feel a sense of belonging. You feel that you can fit in there and you will enjoy it there. That's also very important.
Mhm.
But for my specific job, I did have to be licensed through the state of Virginia as a surgical assistant. And I also had to pass the CSA exam. And I wrote this down so I wouldn't mess it up. It is through the National Commission of the Certification of Surgical Assistants. It's a mouthful. So I did have to have those two things in order to even apply.
Okay, thank you. And again, please start to put your questions in the Q&A, not in the chat, as much as you can, so we can keep them all organized over here. And I want to just ask one question from my side first, just to make some clarification. What is the difference between a surgical assistant and a surgical technician?
Right. So I get this a lot. Surgical assisting is not commonly known around the United States, especially. So it's a little difficult to distinguish,
Okay,
between the two for some. But a surgical assistant is actually helping the surgeon complete the procedure. So let's say we're retracting tissue and actually helping with the procedure itself. The surgical tech has a vast knowledge of instrumentation, steps of procedures, and normally they are going to be setting up pretty much the groundwork for the surgery itself. So they are handing instruments.
okay.
They are anticipating the surgeon's next move. So I would say, their education is mainly focused on instrumentation, steps of procedures, and that realm.
Okay,
My education is a little different. I do have some of that, but I mainly focused on anatomy and steps of the procedure and surgeon anticipation. So we're a little bit different in that aspect.
okay, that's important for everyone to know. Let me get to some of these questions. Esmeralda and her class at the adult school in Orland, California. How long does it take to get the certificate, that surgical assistant certificate, I believe, that you had to obtain to work where you do now? What was that process, that timeline?
Okay, so there are a couple of different options. There are some Associate of Science certificates that you can obtain, straight from high school. It's like getting an associate's degree. But the program that I actually went through is a master's degree program. It's the only master's degree program in the United States for surgical assisting.
Wow,
So my
master's.
route was a little bit different from a lot of people.
Okay, wow. How long did that master's take?
So I had a bachelor's degree first before I could
Right.
apply. So that I actually did go to a community college first after graduation. So I have an associate's, a bachelor's, and then applied. And I do have the master's degree, which took 2 years.
Wow. Am I looking at some of those behind you? Some of the paper?
Yeah.
I thought so. It looked like it. Yeah, as you should. You should proudly display it. So, okay, a couple of questions here. Tammy Rosage, or I hope I'm saying your last name right, Tammy. Apologies. Please talk a bit about your normal work hours, or options for alternative hours. Like, are you working 12-hour days? Is it 9 to 5? What does it look like?
That's really going to depend on the institution that you're working for. With hearts, especially, it's kind of a crazy world. Cardiac's a little crazy. So I currently work 4 10-hour shifts.
Or
However, I
10-hour
take
shifts.
a lot of call. Lots of call hours.
What does call hours mean?
Right. So call is basically when you are on standby to go into the hospital for emergent procedures, or you may have to stay late if you're on call, even past your normal shift time. If a procedure is still going, you would be the person to stay in that room and cover that procedure.
And how often does that happen that you're going beyond the regular schedule?
I would say quite often right now. We're
Is
pretty
it
busy.
because like you're short staffed, or there's just a lot of activity in the hospital? What's the reason for that?
We are a bit short staffed, but we just have it honestly goes in spurts. And sometimes in, you know, cardiac the cardiac field in general, we get very busy just with emergent procedures. It kind of goes in seasons. You have some months where we're extremely busy and we have emergencies coming in a lot. And then there are some months where it's a little bit slower and you can actually stick to your normal schedule. And that's really nice. You get to go home. But we're just in a busy season right now.
So give us an example of, let's say, whether it's an emergency or a scheduled surgery, like give us like even one recently of like what happens, like the patient comes in and like, and this also Elizabeth Young and her students asked the question, like who's in the room? Like what does it look like in in surgery, either preparing for it or during, like how does it, like how does the day kind of flow?
Okay. So I come in around 6:30 or 6:45, and we normally all the staff members meet up for a huddle in the mornings, and we talk about any important announcements. And then we go into our scheduled OR room for the day. Um, and once I'm in there, I'm usually joined with the circulating nurse and the surgical tech and a physician assistant. So, and the surgeon, of course. We also have an anesthesiologist present and a perfusionist present for our procedures. So, lots of people are in the room. Um, and the patient comes in the room, myself, anesthesia, and the nurse are all kind of prepping the patient to prepare for surgery. And then at that point, once the patient is intubated and asleep, of course, that happens before intubation, we will start to drape and prep, and the surgeon comes in and we start the procedure.
So I really want to stress to students, and I hope the teachers will appreciate how important it is when there's something you don't understand to ask. And you used a term, an occupation, a perfusionist. What is that?
Yes, so a perfusionist is going to be the person that runs the special pump machine that will circulate the patient's blood throughout their body during these procedures. So in one of our heart procedures, for example, we do have to stop the heart. And so during that time, you know, the person needs to get oxygen and blood throughout their body. And that pump, that special pump, is what is going to do that for the patient. So the perfusionist is going to run that machine.
It seems like a pretty important job. I
Oh,
mean, they're all
extremely.
important jobs, but
Yeah.
wow. And again, I we're just stressing how, and if you want to work in the medical field, how important it is to show curiosity, right? Like if you, let's say you had somebody shadowing you, it's probably not appropriate in surgery, but let's just say, and you're just saying all these things to the student and they're just staring at you. Do
Right.
you want that, or do you want them to be active, alert, asking things, engaged, curious? Like, what do you want to see from a future surgical assistant?
Oh, I think honestly, in any career, if you want to be good at something, no matter what it is, um, you need to put forth effort in that subject, in that profession, and ask questions. That is so important. If you don't understand something, ask questions. After asking questions, if you still don't understand it, you might want to do some research and look things up yourself and ask more questions. There are no stupid questions,
Right.
Um,
So it doesn't mean that you're dumb or you're just not
right,
getting
no,
it. If you say, what's a perfusionist? You're not going to be like, why don't you already know that?
oh,
You'll
no,
answer that question.
of course. I would much rather work with someone that is willing to ask questions and be interested in what we're doing. That
Hmm.
is so important. Not only does it help me in my career because explaining things actually, solidifies that information, but also it helps the person that is asking the questions. I hope that I can lead them down the right path or help, fuel
Hmm.
their food for thought in that scenario.
Can I see some hands up from the teachers? Is this helpful to the students to know that it's okay to ask? They want you to be curious. They want the students to engage. That's so important here. We have a good question from Sandy Ayers' class in Battle Mountain. Kylie, do you have aspirations to become a surgeon, or do you like the position you are in?
I love that
Great,
question.
great question.
There is absolutely nothing wrong with wanting to constantly strive to continue your education or want to achieve the highest goal in a company. Um, I personally do not want to be a surgeon. Absolutely enjoy working with the surgeons that I currently work with. They're amazing. They're smart beyond belief. Um, but I don't want to be a surgeon. So I chose not to go that route. There is obviously with obtaining that amount of education and being in charge of patients, there's a ton of responsibility and
Yes.
liability. And I like just being able to focus on the surgery side of it and assist with surgeries instead of all the other patient care aspect.
I understand. I understand. I wanted to also ask you, and I know we have somebody here, a class here from Buffalo.
Oh, wow.
Who remembers just a few weeks ago the player on the Buffalo Bills who had cardiac arrest on the field on Monday Night Football? I'm sure many of us saw that or know about that. And just for a reminder, I was pulling up some photos of that situation. So many of us were just watching in complete shock. We don't understand what's going on. We don't have the medical knowledge but tell us how you perceive the situation and how the trainers and medical staff tended to him, and also what probably went on at the hospital. What did it all say to you?
Well, so I honestly am not a huge football fan.
Sure.
If you guys are, that's amazing. But I did hear about this, of course, and we did discuss it at work because that's what we do.
Of
Um,
course.
so from my perspective on what happened, our hearts are amazing muscle structures and they're strong and they're resilient, but they're also very delicate. Once I have seen a heart, I see hearts every day. You can poke a heart a certain way and it will change the way that it beats for a second. It has to react to the stimulus. And I just think that he was hit at the perfect time in his heart rhythm and it led to cardiac arrest. It's called commodio cordis, which normally happens with younger athletes, and normally it's caused by a blunt object hitting them like a baseball. Um, but for him, he obviously didn't fit the normal stereotype for
Right.
that. But he did go into cardiac arrest. I think that it is amazing that someone was able to start CPR on him immediately. Um, And so I would say, as some people, folks who are interested in the medical field, if you can go to a CPR course and obtain a CPR certification, do it, because it is useful for wherever you are in life. But I think since they were able to start CPR quickly and get him to a nearby hospital quickly, that really made all the difference in the world.
Are you surprised at how quickly he recovered and left the hospital?
Yes and no. I think it really depends on the patient. We see some patients who um, are able to recover quickly, and some that you would expect to recover quickly and then don't really. So a lot goes into that. But I think with him being very active and a healthy individual, I think that definitely helped a lot.
Okay. So without, you don't have to get into naming any names, but tell us like what's in front of you the next few days. Do you have several planned surgeries? Obviously, you don't know about emergencies, but what's looking ahead for you this week or next week? Like what's going on in your medical office?
Right. So honestly, we have a packed schedule of surgeries, which continues from uh, COVID times of being backed up and needing to get people on the schedule. So we are very busy. We run at least 4 operating rooms a day, and those are, I mentioned the amount of staff that are usually in the room. So
Wow.
they're busy rooms. Um, and so we are doing heart procedures, whether that is bypass grafting the heart to get blood flow to the tissue that isn't being perfused that well, or we will replace heart valves. We also do lung procedures at our hospital as well. So we're doing heart and lungs every day.
Wow. Four. So it's at times, are there 4 rooms going at the same time?
Yes, every day.
Wow. And how many people on average are in each room?
Let's see, at least 6 people, I would say, are
So
in
around
each.
20 to 25 people working in across those 4 rooms, like all day.
Hmm.
And
Yes.
are the teams always kind of the same 6 people, or do they get mixed up?
No, we rotate. We all work with each other at some point. It's not usually the same people in the room every single day, which is nice. You get to see different people and have different conversations throughout the day. So
Yeah,
that's
yeah. And you must be all pretty close. I mean, working on something this critical, this sensitive, you have to develop pretty tight bonds and really a lot of trust, wouldn't you say?
Oh, you definitely do. So I think in that aspect, being able to work as part of a team or with a group is something that's very important. Not only would it be beneficial for this field, it's beneficial in other aspects of life as well.
Sure.
We do have a very small team. Like right now, I think we have 6 surgical assistants. So we are all very close. We have no option but to be close when we're there for long hours, long cases, every day.
Wow.
So
Yeah, you're really in the trenches together doing really, really difficult work. I know that you need to get to your job. So if you'd like, we'll let you say goodbye. I want the group to stay with me for a few more minutes. I want to explain our free contest. So everyone's hang tight. We're going to let Alex go because she has to get back into the fray. But can we all just, with some hands up, some virtual thank yous for having her with us? I thought it was excellent advice. Everyone else hang tight. Don't leave. What I want to share with you is important for your CTE program. But Alex, thank you very much, and best of luck this week and throughout the year.
Thank you so much for having me and for asking questions. I am going to put my work email address in the
Please.
chat. If you've got questions, I would be glad to answer them and help
Wonderful.
you out along the way. But I hope you have a great rest of your day. And thank you again for letting me
Thank
join you.
you. Thank you, Alex. Yeah, please share your email. We'd love to pass that around.
I sure will. Thanks.
Okay, so like I said, hang tight. I want to further explain this contest that we are launching next week called America's Next Great Intern. And we're asking students to show us their best skills across these 5 areas. They're going to show us a professional handshake, showing us how they can leave a voicemail and how they would answer the phone at a place of business like a receptionist. They're going to show us an email in which they update the teacher or employer on the status of a project. Show us an example of a time in which they demonstrate resiliency through a challenge, and showing us how they can research a business, develop questions about the business as if they're walking into an interview. And every student who participates, middle school, high school, post-secondary, will receive a certificate of completion and an e-portfolio of the work they turn into us, which looks like this. So all the work they give us, we'll give back as a portfolio. So you can use it back in your community to pursue opportunities and show that you have the necessary communication skills to be successful in that role. Most importantly, we have lots of prizes. Let me explain those. And you can ask any questions in the chat as we go along. Please do. The national finalists, we will do a submission period in February, and we're going to choose middle school, high school, and post-secondary finalists for a public vote, an online public vote in March. And the finalists will receive Amazon gift cards, a letter of recommendation from our company. The top winners will receive banners for your school. The teacher or coordinator of the overall first place winner will receive a cash prize of $250 for the classroom. The overall first place winner for high school post-secondary will receive a $200 gift card for professional clothing, a professional headshot, and the chance to be a paid virtual intern with our company in the summer or the fall 2023. So really good prizes, very real, legitimate, everything. And we want everybody to participate, because win or lose, you're going to get a portfolio, and you're going to be able to show off that you have these skills that every employer is trying to find, those soft skills, those durable skills, I'm hearing people call them today. So the link to, we want the teacher or coordinator to register for the students to receive all the contest materials. So, no, Elizabeth, thank you. We want the student to show us all of these skills. They're all laid out in a reference guide for the contest, where we give detailed examples for every single category, which the student will follow to then show us those skills. So there's 5 skills, takes about a few hours to complete all 5. And you have the month of February to do it. And we provide lots and lots of guidance for everything. It's all spelled out. So that's the link to register your class or your school. There's no obligation beyond that you have to do it, but by registering, you receive the contest materials. And everything, the submission form for students goes live next week, but you can start to see these materials now. One of the other items we asked to be filled out is a waiver by the student or their parent or guardian, so that we can make the student's name public if they are determined to be a national finalist. So we're really excited about it. We've had lots of signups so far. And we think it could be just a great way to showcase not only the students' employability skills, but for the CTE programs, to show your local community that you stress these skills and you're showing your students off in a national contest. So we will be, for the cities that have finalists, we will be doing a promotional campaign in those cities telling the local media that you have a student in your community who is now a finalist in this contest. So there's a lot to gain from the community, for the school, for your class, for your student, and it's all free. Any other questions about the contest right now in the chat? Again, we'd love for you to participate, be part of this, something new and different. And of course, February is National CTE Month. So it's the perfect time to dig in on these skills and help students to showcase to the outside world that I know how to use the phone. I know how to write an email. I know how to shake a hand. Let me show you I have the proof. So if you have questions, continue to ask them. I'll just mention the last few things while we're together and we'll wrap up a few minutes early. Again, if you missed this offer at the beginning, we put together a Google Drive folder of resources to help students handle failure. And if you would like these resources, which is completely separate from our contest, just we like giving out free stuff and opportunities to show the chance to learn these skills. So if you'd like these resources free for your class, and you didn't do it at the beginning, go to the chat, type the word interested and your email address, and we will email it to you. And if you are new to our community, we'd like to set a 5-minute phone call the next day, tomorrow, just to help you get to know us and use our resources and locate them in the Google folder and push them out to your school. So if you miss us at the start, just put your email address in the word interested. And if you're new to us, we'll send you an invite for Wednesday, which you can reply back with another time if it's more suitable. If you're watching on a recording, you can also have these failure resources. Email us to the email in red. Also, on February 15th, we're talking to a childcare professional. Please plan to join us for our next Dream Job session in Zoom, just like this. And finally, everybody who's joined us today, you'll receive a certificate of completion for being here. You'll receive that in your email. You'll also get a recording of today's webinar in your email on Wednesday. So a lot of stuff we're pushing out at you. I know it's a lot of different announcements, but we're always trying to innovate and give you new free resources to help students communicate at their best. And again, if you want to just learn more about our company, welcome to visit our website. We have a full online curriculum teaching these skills. We have a variety of products and resources to help your students. The contest is free. Our webinar series is free, and that's a great way to get to know us and keep your students busy throughout the winter and spring. Are there any other questions about our contest in particular, since that is live and happening and kicks off in 1 week? If you have future questions, I would encourage you to, I'll put another email in the chat for you. You can send us an email at any time to our support email and we'll get back to you, answer questions about our webinars or our contest or our company in general. We're here for anything that's on your mind. Otherwise, I appreciate you being here, hanging around for this last few minutes. I hope you enjoyed our session with Alex, who gave us a really good breakdown of her job and what it's really like. And we hope that you'll join us for the session in a few weeks with a childcare professional. Until then, have a great rest of your school week, and we will talk to you soon. Thanks again. And thank you, Andrea, for all of your help.